Hello everyone, I hope you all fine. Thank you for watching my short videos concerning health matters, and thank you for supporting me. My name is Mark Katumila. Today we are on the fourth session and our topic today is on infertility. So I'm going to give a brief knowledge or information about infertility so that we can all know in a simple language what infertility is and the details that are related to the same. So what is infertility? Infertility is a disease of male and female reproductive system defined as failure to achieve pregnancy after 12 months or more of regular and protected sexual intercourse. This is to say that infertility will only be diagnosed if a person has experience of having a regular sexual intercourse for more than 12 months without achieving pregnancy. Infertility is a common problem worldwide, and millions of people are having the same problem. So it's a subject that at least everybody should know what's about it. There are two types of infertility. We have primary infertility and secondary infertility. Primary infertility is where a pregnancy has never been achieved, while in secondary infertility is where at least one pregnancy has been achieved prior. We have two causes of infertility. We have male-related causes and we have female-related causes. This is because in all the cases of infertility, 30% of the cases are due to female-related causes. 30% of infertility are also due to male-related causes, and the other 30% of infertility cases we have in our society or community are due to the problems from both the male side and the female side, and the 10% are due to the idiopathic causes, the causes which are not known. For the female related causes, we have causes as a result of abnormalities of reproductive organs or reproductive system, and we have causes as a result of abnormality of the endocrine system. Now for the male, still we have problems of the endocrine system, that is the system which is responsible for the production of the hormones which are responsible for reproduction, and also the abnormality of the reproductive system of the male. For the female related causes, infertility is caused by abnormality of the endocrine system and also disorders of the reproductive organs. When we talk of reproductive organs, we talk of uterus, fallopian tube, ovaries, we talk of all the system reproductive organs. So if there is a disorder or abnormality of reproductive system, that one will make one to be infertile. For fallopian tube, we can have abnormality or disorders of the fallopian tube such as blockage. Now, blockage of fallopian tube can be as a result of untreated sexual transmitted infections, complications of abortion, etc. While abnormality of the uterus, they can be inflammatory abnormalities, they can be benign abnormalities, they can be congenital abnormalities. Abnormalities of the ovaries still are in different categories, but as long as there is abnormality of any reproductive organ, that one can warrant a person to be infertile. When we talk of endocrine system abnormality or disorders, it's where we talk of hypothalamus and pituitary gland. This is where the reproductive hormones are produced. Now, where there is a problem with the reproductive hormones, then definitely a person might not have abnormality of the reproductive organs, but as much as there is abnormality of the reproductive hormones, this person will also be infertile. When it comes to male-related problems or male-related causes of infertility, we also talk of the endocrine system conditions or disorders, and we also talk of reproductive system disorders. We can have the problem with ejaculation, we can have the problem of the functionality or the quality of the sperm when it comes to the shape of the sperm, that is morphology. If we have a problem with the movement of the sperm, that is motility. If we have a problem with the ejaculatory tract, if we have a problem with any part of the reproductive system of the male, that one can warrant for a person becoming infertile. And if we have a problem with production of the hormones which are responsible during fertilization, that one also might cause one being infertile. For the hormones such as testosterone are responsible for the production of sperm. So if we have a problem with the production of the hormone, then definitely the person might become infertile. About the management or treatment of the infertility, it ranges from a specific cause of the infertility or your infertility. If it's because of hormonal issues, then your doctor will advise accordingly. If it's about the abnormalities of the reproductive system or the disorders of the reproductive system or reproductive organs, your doctor will also advise accordingly. The medication strategy will be based on the cause of the infertility. So anytime for the female, anytime you experience abnormality in your ovulation or menstrual periods, whether it's menorrhagia, that is having excessive bleeding, whether it's irregular menses, anytime you have any irregularity or any symptom to warrant for imbalance of the hormones, you should seek medical attention, both male and female. Anytime you experience or you happen to find out that you have a sexual transmitted infection, you should make sure that it's treated accordingly so that it doesn't predispose you to becoming infertile. There are predisposing factors to infertility. We have factors like weight, being overweight and being excessively underweight may affect the ovulation cycle, and that one will have an impact or an effect to infertility. There's an aspect of age. We have a reproductive age of 15 years to 49 years. So the production of eggs in women decreases as age moves. So as a person advances to over 40, over 45 years, we expect that the fertility rate of this person will decrease or decline. There's an aspect of smoking also predisposes one to infertility, because smoking has an aspect or tendency of precipitating one to having abortions or miscarriages. So excessive smoking will predispose one to having, or may predispose one to having or becoming infertile. We have an aspect of alcohol, excessive alcohol consumption, and substance abuse. So excessive alcohol consumption also has may have a likelihood of predisposing one to infertility. The other predisposing factor is excessive use of emergency hormonal pills. This one has a direct impact to the hormonal factor and also to the reproductive system or reproductive organs of the female. So excessive use of this emergency hormonal contraceptive pill has an effect to fertility. The other aspect is about overexposure to environmental pollutants, overexposure to radioactive rays. This one also has an impact or has an implication to fertility of a person. There is also an aspect of unprescribed abortion. So if you procure an abortion unprescribed, the chances are it will not be handled accordingly, and this one can also predispose you to becoming infertile. Also, the post-abortal care, if you don't get the ideal post-abortal care, this one can also predispose you to becoming infertile. There is an issue of having multiple sexual partners. So this one will expose you to having sexual transmitted infections, which, if they are not treated accordingly, will also predispose you to becoming infertile, or they might have an aspect of you suffering or having fertility issues. These are just few predisposing factors, but there are very many factors that can predispose one to being infertile. So anytime you feel that you have a fertility issue, you should seek medical attention. Anytime you feel that you have fertility issues, kindly seek medical attention, explain to your doctor, and he or she will advise you accordingly. Thank you very much for joining me in this session and listening to this video. Kindly, I would request you to share the knowledge so that every one of us can internalize and understand what brings the infertility, what causes it, what predisposes it, and what we should do in case one finds him or herself in such a scenario. Join me in the upcoming sessions concerning the medical related issues so that we can share this knowledge together. Thank you.